NLN NEX Easy Questions. Question 1. Which milliliter amount equals 1.5 L in this reading skill item? Option A, 150 ml. Option B, 15,000 ml. Option C, 15 ml. Option D, 1,500 ml. The correct answer is option 1 liter equals 1,000 ml, so 1.5 times 1,000 equals 1,500 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 2. During a quick NEX review of a vocabulary skill item, which word is closest in meaning to gradual in a patient education passage? Option A, slow. Option B, metallic. Option C, sudden. Option D, loyal. The correct answer is option gradual means slow, so that choice matches the meaning in context. Metallic relates to metal, not speed. Sudden means quick, not slow, and loyal means faithful, not slow. Question 3. After checking the choices in a grammar skill item, which answer identifies the substance dissolved in a solution? Option A, solvent. Option B, precipitate. Option C, solute. Option D, catalyst. The correct answer is option. The solute is the material being dissolved. Solvent does the dissolving. Precipitate is a solid that forms in solution, and catalyst speeds a reaction. Question 4. If a algebra skill STEM gives one clear clue, which statement gives the best main idea of this passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, orientation should never include stories. Option B, former patients stopped the program. Option C, volunteer programs grow without communication. Option D, personal stories can motivate people to participate. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage. Former patients stopped the program, is not supported by the passage, and volunteer programs grow without communication, is not supported by the passage. Question 5. When time is limited on a data interpretation question, which number is 10% of 60? Option A, 50. Option B, 6. Option C, 60. Option D, 70. The correct answer is option 10% means 10/100, so 60 times 10/100 equals 6. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 6. Given the information in a reasoning drill item, which milliliter amount equals 0.75 L? Option A, 750 ml. Option B, 7,500 ml. Option C, 75 ml. Option D, 7.5 ml. The correct answer is option 1 liter equals 1,000 ml, so 0.75 times 1,000 equals 750 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 7. Suppose a similar timed practice item appears on test day. Which word is closest in meaning to modify in a patient education passage? Option A, change. Option B, repeat. Option C, freeze. Option D, ignore. The correct answer is option modify means change, so that choice matches the meaning in context. Repeat means do again, not change. Freeze means make solid by cold, not change generally. And ignore means not notice, not change. Question 8. While working through a timed score report set, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, convection. Option C, conduction. Option D, radiation. The correct answer is option conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, convection moves heat through fluid circulation, and radiation transfers energy by waves. Question 9. Before choosing an answer in a study plan item, Which statement gives the best main idea of this passage? A school added quiet study rooms, and students reported fewer distractions. Option A, students no longer needed to study. Option B, reducing distractions can improve study conditions. Option C, distractions are always helpful. Option D, quiet rooms increase noise. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study is not supported by the passage, distractions are always helpful is not supported by the passage, and quiet rooms increase noise is not supported by the passage. Question 10. A student sees this review checklist idea on a NEX review. Which number is 20% of 250? Option A, 270. Option B, 500. Option C, 230. Option D, 50. The correct answer is option. 20% means 20/100, so 250 times 20/100 equals 50. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 11. One common mistake practice problem tests this skill. Which milliliter amount equals 0.25 L? Option A, 2.5 ml. Option B, 250 ml. Option C, 25 ml. Option D, 2,500 ml. The correct answer is option. 1 liter equals 1,000 ml, so 0.25 times 1,000 equals 250 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 12. Several choices look tempting in a calculator-free item. Which word is closest in meaning to precise in a patient education passage? Option A, gentle. Option B, vague. Option C, ancient. Option D, exact. The correct answer is option. Precise means exact, so that choice matches the meaning in context. Gentle means mild, not exact. Vague means unclear, not exact. And ancient means old, not exact. Question 13. For this patient chart nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, classification. Option B, bias. Option C, estimation. Option D, replication. The correct answer is option. Replication checks whether results are reliable across repeated trials. Classification is grouping items, bias is a systematic error, and estimation is an approximate calculation. Question 14. In a short lab result practice STEM, which statement gives the best main idea of this passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, hand hygiene cannot affect infection. Option B, training increased infection rates. Option C, training may have improved compliance with hygiene practices. Option D, the refresher removed all risk permanently. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection, is not supported by the passage. Training increased infection rates, is not supported by the passage. And the refresher removed all risk permanently, is not supported by the passage. Question 15. Among the choices in a health literacy item, which number is 30% of 120? Option A, 90. Option B, 150. Option C, 360. Option D, 36. The correct answer is option. 30% means 30/100. So 120 times 30/100 equals 36. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 16. Using the facts in a safety protocol question, which milliliter amount equals 2.4 L? Option A, 240 ml. Option B, 2,400 ml. Option C, 24,000 ml. Option D, 24 ml. The correct answer is option. 1 liter equals 1,000 ml, so 2.4 times 1,000 equals 2,400 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 17. Based on the clue in a concept map item, which word is closest in meaning to rapid in a patient education passage? Option A, dull. Option B, slow. Option C, fragile. Option D, fast. The correct answer is option. Rapid means fast, so that choice matches the meaning in context. Dull means not sharp or interesting, not fast. Slow means not fast, and fragile means easily broken, not fast. Question 18. Consider this high-yield hydration log concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, artery. Option B, capillary. Option C, vein. Option D, trachea. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Artery moves blood away from the heart, vein returns blood to the heart, and trachea carries air. Question 19. Near the end of a vital signs review session, which statement gives the best main idea of this passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, patients cannot benefit from reminders. Option C, appointments no longer need scheduling. Option D, reminders can help patients remember appointments. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders caused more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 20. Across similar cell energy nursing entrance questions, which number is 12% of 40? Option A, 52. Option B, 4.8. Option C, 28. Option D, 48. The correct answer is option. 12% means 12/100, so 40 times 12/100 equals 4.8. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 21. Since only one choice fits the patient teaching clue, which milliliter amount equals 1.2 L? Option A, 120 ml. Option B, 1,200 ml. Option C, 12,000 ml. Option D, 12 ml. The correct answer is option. 1 liter equals 1,000 ml, so 1.2 times 1,000 equals 1,200 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 22. From the information in a dosage label item, which word is closest in meaning to retain in a patient education passage? Option A, guess. Option B, expand. Option C, keep. Option D, discard. The correct answer is option. Retain means keep, so that choice matches the meaning in context. Guess means estimate, not keep. Expand means increase, not keep. And discard means throw away, not keep. Question 23. At a testing desk during an infection control review, which answer identifies the organ that produces bile? Option A, gallbladder. Option B, liver. Option C, pancreas. Option D, kidney. The correct answer is option. The liver produces bile, which helps digest fats. Gallbladder stores bile, pancreas secretes enzymes and hormones, and kidney filters blood. Question 24. Inside a fall prevention science or skills item, which statement gives the best main idea of this passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, comfort never changes with practice. Option B, the exam has no time pressure. Option C, timed practice can build exam familiarity. Option D, timed sets remove all content gaps. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. The exam has no time pressure is not supported by the passage, and timed sets remove all content gaps is not supported by the passage. Question 25. Through careful reading of a nutrition note stem, which number is 20% of 200? Option A, 220. Option B, 40. Option C, 180. Option D, 400. The correct answer is option 20% means 20/100, so 200 times 20/100 equals 40. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction.